Hello, my name is Dr. Catherine Speedy and I am a Sustainability Fellow at Health Education and Improvement Wales. I started learning about sustainable healthcare 3 years ago. The Lancet, a general medical journal, describes climate change as the greatest health threat of the 21st century, but that it could be the greatest health opportunity of the 21st century. The annual carbon footprint of the NHS in Wales has been calculated as 1 million tonnes of carbon dioxide equivalent per year, and the Welsh Government have published a strategy to reduce this to net zero by 2030. Decarbonisation is important, but sustainable healthcare goes beyond this to think about how we can improve health services by streamlining service delivery and eliminating waste, and reduce demand on services by patient empowerment and illness prevention. So what is sustainable healthcare? Sustainable healthcare is about meeting the needs of patients and populations of the present, whilst considering the needs of future generations. We must first do no harm, and this means reducing our impact on the environment. If you want to find out more, visit our Climate Action webpage. Every health board in Wales also has its own green group, which is a great way of getting involved. No action is too small. Together, we can make a difference.